CEN Test Prep Exam Texas. Question 1. A positive Koenig's sign is suggestive of Option A, a cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Question 2. A hyphema involves Option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 3. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 5. A patient leaving against medical advice, AMA, must be informed of Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 6. The safe harbor provision for nurses typically refers to Option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 7. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 8. Murphy's sign is used to assess for Option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The purpose of administering surfactant to a patient with ARDS is to Option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 10. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer Option A, folic acid. Option B, a vitamin B12. Option C, thiamine. Option D, magnesium sulfate. The correct answer is option C, thiamine. Question 11. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects. Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 12. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 13. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 14. The most common cause of acute renal failure in hospitalized patients is option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 15. The most critical treatment for a patient with heat stroke is option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C, administration of antipyretics. Option D, active external revarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 16. SIRS, systemic inflammatory response syndrome, criteria include all of the following except option A, heart rate greater than 90 bpm. Option B, respiratory rate greater than 20 or PACO 232 mmHg. Option C, temperature 38 degrees C or 36 degrees Celsius. Option D, elevated troponin. The correct answer is option D, elevated troponin. Question 17. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 18. A Call's fracture involves the option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 20. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 21. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PACO 258, PAU 262, HCO 324. This represents option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 22. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer, option B, esophageal varices, option C, diverticulosis, option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 23. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test, option B, administer pain medication, option C, prepare for pelvic exam only, option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 24. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis, option B, pyelonephritis, option C, nephrolithiasis, option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 25. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, left anterior descending artery. Option B, left circumflex artery. Option C, right coronary artery. Option D, left main coronary artery. The correct answer is option C, right coronary artery.